Which syndrome is likely to be present? A 28 years old man who present with locally advanced mucinous carcinoma of the cecum, scanty polyp remaining of the colon. His father died from colorectal cancer at the age of the 34 years. So a colonic malignancy, that means presenting in the cecum, which is the right-sided colon, and also his father died from the colorectal cancer. So it is the syndromic patient. Here we can see this is the syndromic patient, and we know there are different type of syndrome present in case of the colorectal cancer, and they are the FAP, which is the familial adenomatous polyposis coli. This may be LINS, this may be cow dung, this may be MYC associated polyposis or Puet-Zeiger syndrome. So what may be the answer of this patient? That means a right-sided colon cancer, cecal cancer, mucinous type. So, and the father died at the age of 34. So which may be diagnosis? So first of all, let's see the LINS syndrome, which is the HNPCC, that means the hereditary non-polyposis coli. So it occurs in case of the germline mutation of the DNA mismatch repair gene. So it is due to DNA mismatch repair gene, which is the germline mutation. And the colorectal percentage, it is the, or CRC, it is the 30 to 70%. And endometrial cancer occurs in case of the HNPCC, it is the 30 to 70%, and gastric cancer occurs the 5 to 10%. And also there may be pancreatic cancer also occurs, or sometimes the duodenal cancer, but most common is the gastric cancer after the endometrial cancer. So what happened in case of the HNPCC or LINS syndrome? It is usually the right-sided. First of all, it is the right-sided. This is mostly mucinous, and third of all, this is mostly most common colorectal cancer, which is the 30 to 70%. And the second syndrome is the familial adenomatous polyposis coli, and it is most common association with the gastric carcinoma in case of male. So the colonic tumor likely to be right-sided and mucinous. So this is the most important. First of all, right-sided. Second of all, the mucinous. So right-sided, mucinous. Go for LINS syndrome. And colonoscopy usually done 1 to 2 yearly from the age of the 25. Consideration of prophylactic surgery. Extracolonic surveillance is recommended. Why extracolonic surveillance is required? Because it may affect the stomach, it may affect the duodenum, it may affect the pancreas, and in case of female, it may affect the endometrium. So the extracolonic manifestation or extracolonic surveillance is very important. And also there is the extracolonic cancer may develop. Now the LINS syndrome is likely right-sided colonic cancer, younger age, and it is usually poorly differentiated mucinous cancer. So mucinous cancer always poorly differentiated and prognosis is poor. And Amsterdam criteria can be used to identify family risk from the genetic testing, and the rule is the 3 to 1. 3 mean at least 3 family member affected, 2 means successive 2 generation, and 1 means 1 family member died before the age of the 50 years. So it is the LINS or HNPCC, hereditary non-polyposis coli. Why? First of all, this present the locally advanced mucinous carcinoma of the cecum. Cecum is the right colon and mucinous. So this point is enough for diagnosis of the familial adenomatous, the LINS syndrome. But there the 3 to 1 rule, that 3 to 1, that means 3 member involved, 2 successive generation, and 1 died before the age of the 50. Here we can see his father died at the age of the 34. So this point is completely compatible with this. So this is the LINS syndrome. Other option here, the FAP. In case of the FAP, the colonoscopy findings is more than 100 polyp. And cow dung disease, MYC associated polyposis, and Puet-Zeiger syndrome, they are different from this clinical feature.